Generalized anxiety disorder involves uncontrollable excessive worry for more than 3 months. Some risk factors include genetics, such as if another family member has anxiety, exposure to a traumatic event or experience, medical conditions, and adverse effects of medications. They can also be substance-induced, such as from drugs or alcohol. Some symptoms include restlessness, muscle tension, avoidance of stressful activities or events, increased time and effort required to prepare for stressful activities or events, procrastination and decision making, and it also seeks repeated reassurance. Greg's scenario is that he has problems sleeping at night due to anxiety. Hello, Greg. My name is Ashley, and I will be your nurse today. I just want to let you know that anything you say in this room will be kept confidential unless you pose a harm to yourself or anyone else. What brings you into the clinic today?
I've been having a lot of problems sleeping, and I'm not sure what's causing it or how I can get rid of it.
How long have you felt this way?
Well, I started school back in August, so I'm guessing it started then, so about 4 months ago.
Tell me more about what has been happening in your life lately.
Well, I'm a senior nursing student, and like I said, I'm in school, so that's a lot of stress. And I've got a big comprehensive exam coming up in a couple of weeks, and I also get pretty stressed out when people ask me where I'm going to go in life after I graduate.
It sounds as though school is a pretty big stressor in your life.
It is.
Tell me more about the stressors from school or any other stressors in your life.
Well, I think a big thing is my parents never graduated from college, so they have really high expectations of me. And they also always call me with like financial problems, and I feel like they call me either once, if not every other day. And it just takes up a lot of my time and makes me worry about home when I can't get there as much as I feel like I should.
It sounds as though you're really concerned about your parents' finances and how you going to college and graduating has an effect on them.
Yeah, it's taken a big toll on me.
I bet that's really a hard thing to deal with, especially when you're juggling school too. Are there any medications or any medical conditions that you've been diagnosed with in the last few months?
I haven't had any diagnosis, and like the only meds I've ever taken throughout my life would be antibiotics.
Tell me more about any symptoms that you've noticed that are abnormal besides the restlessness.
My neck has been hurting a lot. Like I've just been sleeping on it wrong, which I don't get that because I'm not sleeping. And then usually I'm on top of things with my homework and knowing what I'm doing for assignments. And lately I've just been really out of it, not knowing what I have going on, what's due, and I've really had to ask a lot of friends for help.
It sounds as though you're having muscle tension. Also, you're requiring more time to get things done and also asking for more reassurance from your classmates about homework.
Yeah, it's really hard.
What have you done in the past to limit your anxiety?
Well, I like to listen to a lot of music and usually have a beer or two.
Have you been introduced to any relaxation techniques or any group therapy?
No, I've never heard of them.
Some suggestions I have for the relaxation techniques are exercise, deep breathing, guided imagery, meditation, muscle relaxation, and journal writing. Also, there is an anxiety management group at the Student Center for Health and Counseling here on campus. If you would like me to get some more information on the techniques in the group, I sure can do that for you.
Yeah, I think that'd be a good idea.
Would you also like to possibly speak with a doctor about some medications that could help you reduce your anxiety?
Well, like what I've learned in nursing school is there's a lot of medications that are out there for anxiety and so many horrible side effects, like the chance for suicide and weight gain. Heaven forbid I gained weight. But I'm just afraid that they might not work for me.
There's a lot of options out there, and sometimes with anti-anxiety medications, it's trial and error. If you notice that a side effect is really affecting you, you call your provider right away, and they'll either reduce your dose or maybe even switch you to completely new medication. It might take a couple of medications to see what works for you, but a lot of times a doctor will be able to assess you and figure out what kind of medication is best for you.
Okay. So I think that'd be probably a good idea if they just keep monitoring it.
I will set up an appointment for you. Do you have any more questions or concerns for me?
No, I don't think so.
Okay, today we talked about your anxiety and some options to help control this. I really feel that you're ready to control your anxiety, and I really hope that this helps with your school and family life. I hope you have a great rest of the day.
Thanks, you too.
Thanks.